Hello and welcome to Wellness Wednesday. I'm James Currie with the Communication Department here at MCHD, and I'm talking to Skandan and Sequayah, and they are from the Health Equity Office. How are both of you?
We're good.
Doing great.
That's great. All right, now I know who you are, but nobody else knows who you are and what you do. So tell me what the Health Equity Office does at MCHD.
The Health Equity Office, it was recently established thanks to funding from the CDC that was given on down to the Alabama Department of Public Health and then to MCHD to establish this office. So what we want to do is reduce health disparities in Mobile County and assure health equity in our 15 target zip codes that we do our work in.
Mm-hmm. Now you alluded to health equity. Now what does that mean? What does that mean to the layperson?
So health equity is when everybody has the opportunity to be as healthy as they possibly could be. So this means removing any sort of barriers such as social, economic barriers based on race or ethnicity, and removing all these barriers so people can achieve their full health.
Now, I know you're not just, you don't just have a map up on the wall and you're throwing a dart at it just to guess which zip code you're at. So I know you've got targeted zip codes, and there are a lot of metrics involved with, why you're doing what you're doing. So let me look at my notes here. 1 second. Let's see. Yeah, can you go down your target areas and your zip codes, for me?
So we have areas 1, 2, and 3. And that's like the Wilma area, Chickasaw area, and they are predominantly white, and they have high rates of poverty and low access to health care. Then we have area 3, and it's predominantly Black, and it has the same high poverty rates and low access to health care.
So I know you all have a game plan. You have a game plan for each month. You had a campaign for January that you've already finished. Now, tell me what you did in February for Black History Month. Tell me about that campaign.
So the theme for Black History Month for 2022 is Black Health and Wellness. So our goal is to highlight Black scholars and medical practitioners who really exemplify Black excellence and put them on the spotlight through highlighting their stories through social media and the press.
Okay, so I've got some other things outlined here that I wanted to ask you about. You have some different areas like heart health, HIV and AIDS, sickle cell, and mental health. So how do you break down those different areas of, those challenging areas to be able to cover to make health equal for everyone? Okay, so sorry, we had a little power issue here, so we had to restart. So there were 4 areas that you all were focusing on for February, and they were heart health, HIV and AIDS, sickle cell, and mental health. So tell me what you did to spotlight those 4 areas.
So we first started off with heart health and health equity, and we highlighted the work done by Dr. Daniel Hale Williams, who founded the first Black-owned hospital in America and who performed the first successful heart surgery in the whole world.
Then we have Dr. Abdul Kabir. She did a lot of work during the epidemic, the HIV epidemic. So she noticed that they were only focusing on the white community. So she made it more aware of the Black community because it was affecting us African Americans in a higher rate.
Then we moved on to sickle cell and the Black Panthers. The Black Panthers were public health heroes, and a lot of the work they did, we can still use the work they did to perform our work today. And specifically in the sickle cell community, they provided free testing for African Americans. Sickle cell disease received a lot of poor funding options because it mainly affected those of African descent. So the Black Panthers wanted to fill in that disparity.
Mhm.
Then we have Dr. Mamie Clark. She's best known for her research on race, self-esteem, and childhood development. She was the first Black woman to earn a doctorate at the University of Columbia. That's all I got.
Okay, so you had those 4 things that you focused on this month, one different thing each week. You had pretty good response from it, or how did it go?
Yeah, we received a lot of positive feedback from MCHD employees, just saying like they didn't know about this stuff. So it was good that we were highlighting the work done by these people.
And we tried to pick 4 Black not everybody knows about. So we tried to recognize their work.
Right. Yeah, absolutely. Yeah, it was, it's good factual information that you all provided during the month. And it was good to see those things that maybe people didn't know about, to spotlight them like you did, and to, bring those causes and areas into focus. So you have something going on for March. We don't want to divulge that just yet, so maybe we'll go back and revisit March. And our signal keeps going in and out over here, but we are in a 180-year-old building, so it does lend us a little bit of an excuse that we can say, well, sometimes we have some challenges, just like the Health Equity Office has its own challenges. The communication department has its own challenges when we try to broadcast and record things too. So I appreciate the patience for both of you today as we talked about your efforts for health equity in Mobile County. Is there anything else you'd like to wrap up with to talk about as far as the program?
No, just look for us out in the community. We're both outreach educators, and y'all will be seeing more of us.
Okay. Well, great to get your faces out there for people to know who you are when they see you around at different health events. And we thank you for coming on Wellness Wednesday and going over the really good public works that you all are doing. Some of it's behind the scenes, obviously, but we'll be able to share this information soon enough, the metrics that you all are gathering and the data, and it will help improve overall health of Mobile County. We want to thank you for that.
Thanks for having us on.
Thanks for having us.
You were quite welcome.